na na, na 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 na. Yeah, my lover, put your head up on my shoulder. I give you roses and the rover. Only you get my anaconda.
Hi, welcome back to the channel. This is your Faith Nurse, and today we have Guy with us. Would you like to introduce yourself?
So my name is Guy. I'm currently a Tufts PA student, and I'm in my second semester, and I'll be graduating in 2023.
Whoop whoop! Yes, he is a PA, physician assistant. And can you tell us a little bit about what that is?
So a PA, we are considered mid-level providers, and we work in collaboration with the physician, and we can pretty much, do everything that physicians do. We diagnose patients, we prescribe medication, we have an opportunity to act as a patient's primary healthcare provider, and I'm really excited about, this field and the journey that I'm on.
I'm so excited for you. Honestly, I really am, and I'm happy about your journey. So how has the journey been?
So PA school at first, I'm not gonna lie, it was kind of tough, going into a new environment and something that I wasn't used to, because they say that being in PA school is like drinking from a fire hose, and I can honestly say that that is true. They give you so much information, and you have to, learn it all for these exams, but also make sure that you're preparing yourself for when you go out in clinicals. And my program is accelerated, so we're a 25-month program. So we have exams every week. We're doing quizzes, so it's definitely tough. And now I'm in my second semester, and I'm doing a lot better. I feel like I got the hang of it, and I'm just excited for what's next.
I'm so happy for you.
Thank you.
That's really incredible. But can I ask you a question? What's the application process like?
So with PA school, the application process is different depending on the program that you're applying to. Certain schools have certain requirements. They want you to have 5,000 hours of patient contact, some want only 200, and some want biochem, some want organic. So it really depends. So I had to do a lot of research before applying. I had to look at the schools that I felt like I could see myself as a student at. And once I made a list, and I had everything that I had already done up to that point, and I was like, okay, now I can start pick and choose what schools that I match up with. And that's how I kind of made my list of schools that I plan to apply to.
And how many times did you apply?
So I actually applied twice.
Okay.
The first time I wasn't successful, unfortunately. I applied late, and when I applied, the programs, their deadline was in August, and I believe that I applied in July. So I was kind of late to the game, because the cycle opens at the end of April. And by the time I went for the interviews, the programs had already had their seats filled up.
Okay.
So I was going to interview for, if someone decided not to come into the program, then I could possibly take their spot. So I applied to 6 schools the first time around, and I only had 2 interviews, and out of those 2 interviews, I was given 2 waitlist opportunities.
And the only reason I mentioned that, not to put you on the spot, is because I know so many people are currently on the wait list, or a lot of people have been, denied so many times, and knowing the fact that it's not just a one-time shot and you get into right away, and sometimes it requires you to reapply and just keep going. I think that's like a good point that, and a good testimony that you personally have, just to give other people that are trying to apply some inspiration, like, dang, I didn't get in my first time, but then the second time was the charm for you, and it might be the third or fourth time, but I know, because PA school is so hard to get into, so a lot of people get discouraged when they get that letter that they didn't get accepted. But you're doing great, and you got in the second time, and that's amazing to hear. My next question would be, what advice, I know, like a great segue, right? What advice would you give to anyone that is interested in PA, like schooling wise, like what should they do in order for them to become a great candidate?
So my opinion, you have to bet on yourself. That's the first thing. Like I said, I applied twice. I know kids in my class that have applied 3 or 4 times, so you might not get in the first time around. If you do, great, that's amazing, But just make sure that this is what you want, because you know you're investing a lot of money and a lot of time into it. So definitely make sure that this is what you want for yourself. And I knew that there was nothing that I wanted to do in this world besides be a PA. I knew that that's what I wanted for me, and I was going to do everything that I could in order to accomplish that. And you know, it's competitive, right? So you want to be at the top of your class. You want to have a 3.9 GPA, a 4.0. But I also believe that, you know, being a 4.0 student isn't going to make you a great provider. You need to be able to interact with your patients. You need to be able to know how to talk to other people. So for me, I wasn't that 4.0 student. So what I did was I branched out. I worked as an EMT. I worked in physical therapy. I worked as a medical assistant in pediatrics, and then I moved over to orthopedics, and I worked as a tech over there. So I really branched out, and I got a lot of experience in the field. And not only did that reassure me that being a PA is what I wanted to do, because I was able to work with a lot of PAs, but it also, you know, gave me an edge on other candidates, because I had experience that they didn't. I had, you know, when I applied, I think I had over 4,000 patient contact hours at the time. So I really went out, and I volunteered a lot too. So I tried to volunteer as much as I could, and you know, really just get as many hours as I could, because like I said, I wasn't that 4.0 student, but I knew that if I was given a chance with an interview and just, you know, be able to present myself to whoever was on the board, that they would see that, you know, I am meant for this. So I think you got to believe in yourself, and don't worry if you don't have that 4.0, that's okay, because there are other aspects of your application that you can strengthen up. Like I said, that wasn't me. I didn't have that 4.0, so I decided to go out and I decided to volunteer and get as many patient contact hours as I could.
Wow. Honestly, that is the best advice that you could possibly give to someone, because a lot of people aren't 4.0 students. A lot of people, even 3.9 can be challenging.
Yeah.
So it's the fact that you're branching out and having someone like telling them that the applicants and the people that are, you know, looking at your applications are looking at you as a whole.
Yeah.
And that is honestly, that's some really great advice.
Yeah, and that's something that I try to remember now, because, you know, I want to make sure that I get hundreds on the exams and everything like that. And my program is tough because they have an 80 mark, so you have to, if you get anything under an 80, you know, it's considered not passing. So even if I get an 81 or 82 or even like a 90, I'm kind of like, man, I feel like I could have done better. But I just try to remind myself that, you know, the grades aren't going to make me a better provider. Like, yes, like I need to know the information, because I'm going to be treating people, you know. People are trusting me with their lives. So I need to make sure that I understand what's going on, and you know, I understand how the human body works and whatever they may be dealing with. But I think it's really important to just be able to make connections with individuals, and you know, be able to talk to them and let them know that I'm here for them, and just create, you know, a bond with them. I feel like that's what's really going to help me treat my patients, is that bond that I'm able to create with them.
Wow. No, that's amazing. And I remember like the fact that you said, you know, the 81, the 82.
Yeah.
I personally, even in nursing school, they told you right from this jump that you're not always going to get A's. Like this program is not meant for people that are going to get straight A's. You may, you know, just barely pass, and that's okay. And that's okay, because, you know, at the end of the day, it's progression, not perfection. As long as you are going as long as you're going the way that you need to go and completing everything that you need to complete, that's what matters. And the fact that, you know, and your skills as well add on is the icing to the cake.
And more necessarily applying the skills in clinical setting.
Yeah, 100%.
Yeah, because you could look at PowerPoints all day, but how are you going to apply those PowerPoints to the bedside or in your own primary care? So, G, how's PA school now, and what do you like most about it?
So PA school is going really well for me right now. Like I said before, the first semester I struggled a little bit because it was just so new to me. Being in a new environment, and with COVID made it difficult. I'm not the best with learning online, and when we started our program, we were 3 times a week remote and then twice a week on campus. So it was difficult for me being at home and having to study for, you know, not even just study, but being in class from 8 a.m. to 4 p.m. just in my house. So I'm not very good at that section of it. Like, I felt like if I was actually at the school every day, you know, being outside of my home, not next to my bed, I would have done better. But it's going a lot better for me now. I noticed that that's something that wasn't benefiting me. So what I did was I started going to campus, and I'm pretty much on campus every day, and I'll go to the library whenever we have classes remote, and I do my classes over there. That way, you know, I'm far away from my bed, far away from distractions, and I can just fully focus on what's important, which are the classes. And like I said, the first semester was very tough for me. I was new. You know, just like all of us, you know, when we first start, we don't know how to juggle everything. We're taking, for my program, we take 9 classes a semester. So it's very difficult, and you have to be really on point with your time management. So I struggled with that a little bit, trying to make sure that I was putting in enough time to each and every single class. But now that I have a semester under my belt, I feel like I'm doing a lot better. I've passed all my exams so far. So, you know, I have a lot more to go for the semester, but, you know, things are going good and I'm happy.
I'm happy to hear
No,
that.
we're so happy for you.
Yeah.
Thank
You're
you.
amazing.
Thank you.
We're rooting for you.
Thank you. I
You're
appreciate
champion,
it.
honestly.
I appreciate it.
So I know it's like fast forwarding, but where do you see yourself like specialty wise? I know you're probably gonna look back in this video and be like, I really thought I wanted to do this, but I actually want to do that.
Yeah.
But like as of right now, like where do you think your interest is?
So I try to keep an open mind, and you know, I haven't done clinicals yet, so I'm not sure. I only have the experiences that I've had thus far, you know, working as a tech and working as an EMT. So I really feel like I would love to work in emergency medicine or even orthopedic surgery or plastic surgery. But since I haven't done clinicals yet, I'm trying to not focus on one specialty and just really keep my mind open and my options open. And what I love about PA is that there's a lot of lateral mobility. So I can work in primary care, but also work in emergency medicine. So I know that I'm not going to have to just pick one specialty and stick with it like I would have if I was, you know, an NP or a physician. So that's what I really like about PA, and I'm glad that this is what I chose, because I have so many interests. Like you just saw, you know, orthopedic surgery, plastic surgery, emergency medicine. So those are the ones that I think that I might go into, but I'm trying to keep an open mind.
Well, I'm so happy for you. We're both rooting for you.
Thank you.
We
I
think that what you're
appreciate it.
doing is amazing. We can't wait for you to be our colleague one day.
I know, I'm excited for that. I'm excited.
I know.
for that.
Hopefully, we all work in the same hospital.
Hey, I wouldn't mind that.
You might be my primary care for this shit.
Who knows? Man?
You never know. Small world. But honestly, thank you for coming.
Yeah, no, thank you for having me.
Well, we're just so excited to have you talk to everyone who are interested in becoming a PA. I know it's tough. I know the application process is tough, but just keep holding on and just look at one student right here. He's doing great, and hopefully this can be an inspiration for you all. Well, thank you for coming. It's such a pleasure to have you here with us. Thank you for letting everyone know about your experience and, you know, inspiring other people who are interested in becoming a PA. And we are just rooting for you. We are so excited. We can't wait to call you our colleague and all work in the same hospital one day. Who knows?
That would be dope. I would like that. For real, for real.
Right. But please like, subscribe
right now.
Right now. And share it to anyone who you think might want to become a PA in the process or anything of sort. And we'll see you later. Bye.
Have a good one, guys.